Welcome to the channel Ultrasound Made Easy. Today we talk about early pregnancy ultrasound of 8 week 3 days fetus. This is gestational sac of 8 week 3 days baby. Now on the upper side you can see the fetal pole with fetal cardiac activity present. Early pregnancy ultrasound is important from 6 to 12 weeks of gestational age to confirm the pregnancy. It is important to rule out either pregnancies intrauterine or its ectopic. Now you can see the crown rump length measurement. CRL is measured from the 6 to 12 week of gestational age. It is measured 17 mm corresponding to 8 week 3 days. We measure it from crown to rump excluding fetal limb, yolk sac. So early pregnancy fetal biometry parameter include CRL and gestational sac. Gestational sac is measured from inner to inner. We do not include the rim of gestational sac. It is measured about 37 mm corresponding to 8 week 3 days. So early pregnancy fetal biometry parameters including gestational sac up to 6th week, from 6 to 12 week crown rump length. These are the measurements uh, that correspond to weeks. Early pregnancy ultrasound is also performed to rule out any uterine or ovarian pathology like fibroid or ovarian cyst. It is important to rule out multiple pregnancies, either single pregnancy or multiple pregnancy. So, one, to confirm the pregnancy, then to confirm ectopic or intrauterine, then to confirm multiple pregnancy, then to rule out any intrauterine or ovarian pathological issue like fibroid or ovarian cyst. It is the most important scan to confirm the gestational age and to describe the EDD. That's all for today.